I'm very pleased to introduce Suki Beavers, who was recently appointed to the position of Director of Gender Equality, Human Rights and Community Engagement in UNAIDS Program Branch, where she is leading UNAIDS work to address human rights challenges, including stigma and discrimination, inequality and violence against women and girls, misuse of criminal law and punitive approaches, which remain among the main barriers to effective HIV responses. Previously, Suki was with the National Association of Women and the Law in Canada, where as Executive Director, she led efforts to develop high-quality feminist legal analysis and law reform strategies to advance the rights and empowerment of women in all their diversity. Today, she brings to us a wealth of experience in women's rights and empowerment, sexual and gender-based violence, sexual and reproductive health, and human rights. Welcome, Suki Beavers. And you're on mute.
Thank you. Can you hear me now?
Yes, perfect.
Thank you so much for the warm welcome and the overly glowing introduction. I'd like to start by thanking CSIH for this invitation to UNAIDS, and also to me. As you just heard, I've just started in this new position, and it's a real honor for me to get to join you today on World AIDS Day, and to do it in Ottawa, my home, and the traditional unceded territories of the Algonquin Anishinaabe people. I thought what might be helpful today is to give a little bit of a snapshot of the recent report that UNAIDS has just issued for World AIDS Day, to give you a bit of an idea of where I'll head. The reality is that the global HIV response was off track even before the COVID-19 pandemic. But as you heard from Dr. Tam, the collision of COVID-19 and HIV has set it even further back. To get the world back on track, though, UNAIDS is proposing a new set of bold, ambitious, but achievable targets that, if met, will set the world back on course to end AIDS by 2030. People-centered and context-specific, the targets address the inequalities on which HIV, COVID-19, and other epidemics thrive and leave no one behind. COVID-19 is impacting on the HIV response. However, lessons from the HIV response and its infrastructure have been leveraged for the fight against COVID-19. And this new pandemic has shown that investing in the right to health saves lives and economies. I wonder if I could ask for the PowerPoint presentation to be, thank you. If we could go to the next slide, please. Thank you. So I'll start by saying the world should have been celebrating 30 million people living with HIV being on treatment in 2020. But as of this June, we were off target by 4 million people. Next slide, please. In 2019, an unacceptable 690,000 people died from AIDS-related illnesses, which continue to be the leading cause of death among women of reproductive age globally. Next slide, please. From 2015 to 2020, there were 3.5 million more HIV infections and 820,000 more AIDS-related deaths than if the world were on track to achieve the 2020 targets. New HIV infections dropped by just 23% compared to the target of 75%. And there has barely been a dent in reducing new HIV infection among sex workers, people who inject drugs, and transgender women. And HIV infections among gay men and other men who have sex with men increased by 25% between 2010 and 2019. And in sub-Saharan Africa, young women accounted for 24% of new HIV infections in 2019, despite making up only 10% of the population. Next slide, please. The rapid spread of the novel coronavirus has pushed the HIV response farther off course, As just one example, the scale up of HIV treatment was 50% lower in the first half of 2020 than it was in the first half of 2019. Next slide, please. In response, 3 scenarios were modeled of 3 months, 6 months, and a 2-year HIV service disruption that we saw at the beginning of the COVID-19 pandemic. The results showed that these disruptions could cause an additional 123,000 to 293,000 HIV infections and 69,000 to 148,000 AIDS-related deaths. Next slide, please. However, we have an opportunity to learn from the COVID-19 response. Next slide, please. So we have a crisis and an opportunity. COVID-19 has really provided a wake-up call for countries to strengthen health systems. The pandemic is exposing structural underinvestments in health and the impacts of these underinvestments. But at the same time, COVID-19 can actually be an opportunity. For the first time in many years, the world has seen how destructive a global pandemic can be, and global interest in infectious disease is higher than ever before, and we must build on this interest. The HIV response is part of the solution to COVID-19 and is key to stronger health systems for all. Next slide, please. So what do we need? We need greater investment in community-led HIV responses. We know that for years, the HIV response has been showing the power of communities in the response to a pandemic. Now the leadership, infrastructure, and lessons of communities in the HIV response are being leveraged to fight COVID-19. In countries around the world, HIV communities have played a critical role in the scale-up of differentiated service approaches. For example, delivering medicines by car, motorbike, on foot, to the homes of people living with HIV, and in such diverse locales as the Republic of Moldova, Nepal, and Sierra Leone, and more. In Senegal, for example, organizations led by and for people living with HIV and key populations are repurposing limited resources to make face masks from available fabrics for their community members. In Toronto, as you may all know, Women's Health and Women's Hands, a community health center arising from and serving racialized immigrant and refugee women's communities, is addressing the gap in mental health support services during COVID-19 and helping build a community with each other. Next slide, please. Stigma, discrimination, and violence and punitive legal environments continue to hinder the HIV response. Yet, discriminatory laws persist, particularly against transgender people, sex workers, people who use drugs, people living with HIV, gay, lesbian, and bisexual people, as well as against women and young people. These societal and legal barriers contribute to new HIV infections and AIDS-related mortality by limiting access to services and by diminishing the effectiveness of HIV programs. They also perpetuate a stigma and violence that increase HIV risk. Next slide, please. For example, violence against women is a major factor driving risks for HIV. In areas with a high HIV burden, such as sub-Saharan Africa, women who have experienced intimate partner violence are 50% more likely to be living with HIV. Increasing violence against women and girls during COVID-19 is an alarming reminder that pandemics are unequal and hit the most marginalized groups the hardest. Next slide, please. But we know what works. Reducing stigma and discrimination and ensuring a safe and enabling environment reduces new infections and deaths. We must invest in transformative interventions that uproot harmful laws, norms, and practices. Failure to do so is estimated to result in an additional 440,000 AIDS-related deaths and 2.6 million additional new HIV infections by 2030. Next slide, please. So to get the global HIV response back on track, UNAIDS is calling on the world to re-energize and adopt new ambitious targets for 2025. As I said at the beginning, these targets are people-centered and context-specific, putting people living with and most affected by HIV at the center as leaders, advocates, and service providers. The new 2025 targets are holistic. They focus on high coverage of HIV and reproductive and sexual health services, together with the removal of bad laws and policies, reductions in stigma and discrimination, and community leadership, especially by people living with HIV. The goal is to truly reach and serve those not yet reached by existing practices. Next slide, please. So what's the mantra that needs to guide the response at this point? And it's quite simple. Everyone has a right to health. When fighting COVID-19, the world must learn from the mistakes of the HIV response when millions in developing countries died waiting for treatment. Reaching high levels of service coverage needed to end AIDS can only be achieved in an environment where people living with and at risk of HIV feel safe to use those services. Unfortunately, this is currently not the case in most countries where HIV-related stigma and discrimination, gender inequality, and the criminalization of drug use, sex work, and same-sex sexual relations are powerful barriers to HIV services. But if we work together to end these inequalities, invest in community-led responses, and ensure a fully funded HIV response, we can set the world back on the path to lead to ending AIDS by 2030. Everyone has the right to health. With global solidarity and shared responsibility, we can defeat COVID-19 and we can end AIDS. Thank you.